Human immunodeficiency virus, HIV, is a virus that attacks the immune system, specifically the CD4 cells, T cells, which play a vital role in the immune response. If left untreated, HIV can lead to the disease-acquired immunodeficiency syndrome, AIDS, which is the final stage of HIV infection. Here's a comprehensive overview of HIV. Causes. HIV is caused by the human immunodeficiency virus. There are two main types, HIV-1 and HIV-2. HIV-1 is the most common and widespread type globally. Transmission. HIV is primarily transmitted through contact with certain body fluids, including blood, semen, vaginal fluids, rectal fluids, and breast milk, from a person who has HIV. Transmission occurs through unprotected sexual intercourse, sharing of needles and syringes, from mother to child during childbirth or breastfeeding, and through exposure to infected blood. Stages of HIV infection. Acute HIV infection, the initial stage, occurring within 2 to 4 weeks after exposure. Symptoms may resemble flu and can include fever, fatigue, swollen lymph nodes, and sore throat. Clinical latency, chronic HIV infection. Asymptomatic or mild symptoms persist, but the virus is actively replicating. This stage can last for several years. AIDS, acquired immunodeficiency syndrome. The final stage, characterized by severe damage to the immune system. Individuals with AIDS are more susceptible to opportunistic infections and certain cancers. Symptoms. Early stages may have flu-like symptoms, but HIV infection can be asymptomatic for years. As the immune system weakens, symptoms may include weight loss, chronic diarrhea, night sweats, and opportunistic infections. Testing and diagnosis. HIV can be diagnosed through blood tests that detect antibodies or viral genetic material. Early detection is crucial for timely medical intervention and the initiation of antiretroviral therapy, ART. Treatment. Antiretroviral therapy, ART, is the standard treatment for HIV. ART helps control the virus, maintain immune function, and prevent progression to AIDS. With effective treatment, people with HIV can lead healthy lives. Prevention. Safe sex. Using condoms consistently and correctly during sexual intercourse reduces the risk of transmission. Needle safety. Avoid sharing needles and syringes. Pre-exposure prophylaxis. PrEP medication taken by individuals at high risk to prevent HIV infection. Post-exposure prophylaxis. PEP emergency medication taken after potential exposure to prevent infection. Support and education. Support networks and education are essential for individuals living with HIV to manage their health and well-being. Global impact. HIV/AIDS has had a significant global impact, affecting millions of people worldwide. Efforts to combat the epidemic include awareness campaigns, access to testing and treatment, and initiatives to reduce stigma and discrimination. Vaccines. Ongoing research is being conducted to develop an effective HIV vaccine. While there is no cure for HIV, early diagnosis and appropriate medical care can help people with the virus live healthy and fulfilling lives. Prevention, education, and ongoing research are crucial components of global efforts to reduce the spread and impact of HIV/AIDS.